Tucked away in a region of rugged beauty and a collision zone of tribal cultures, climates, landscapes, and people groups is the northeastern region of India. Comprising of 8 states, this beautiful region shares its borders with Bhutan, China, Myanmar, and Bangladesh, and is connected to the rest of India by a narrow 20-kilometer wide corridor of land. Being geographically isolated from mainland India, healthcare development has been painstakingly slow, but in recent times there has been a leap in medical care and quality hospitals have come up in the region. Dimapur is the doorway to Nagaland. It shares its border with neighboring Assam. It is the only town in the state connected by both railway and airport with the rest of the country. Trade and commerce is largely concentrated around this town. People from all across the state and from nearby towns in Assam come to Dimapur for business and also to avail healthcare facilities. One such institution providing healthcare for its populace and communities is located at 4th Mile in Dimapur. Situated beside the meandering flow of the river Chathe that flows from the Naga Hills into the plains of Assam, and watched over by the rolling Patkai Hills in the distance, is the Christian Institute of Health Sciences and Research, CIHSR. CIHSR started its operations in the year 2007. Since then, every day, hundreds of patients seeking medical attention pour in from different parts of the state and also from nearby towns from neighboring Assam. With its vision to transform society by providing quality healthcare and to develop health professionals who can compassionately deliver quality healthcare, this institution not only provides medical care, but has working amongst its staff dedicated doctors and nurses who are willing to serve wherever required, as is evident in their community health initiatives. To give us an insight of how this institution came into being, we met up with the director of the institution.
The Christian Institute of Health Science and Research, it is a tripartite partnership. Ours is a very unique experiment. It's never been tried before, where you have the government of Nagaland, the Christian Medical College Fellow, and Emmanuel Hospital Association. So the EHA is an organization of about 20 mission hospitals over North and Northeast India. So this is a combination of all these three. They form the society and also the board. When people think about the Northeast of India, they think, such a difficult place. There's a lot of violence, militancy, and all sorts of bad connotations. So we don't think it needs to be like that. We want to create hope. And so we would like to use this as a platform to develop communities and to transform our community within and also impact the community outside. So it's a platform to be able to reach out to the society and impact it.
Healthcare is a global concern. With the rise in health issues everywhere, the need for hospitals to be equipped and prepared to handle different cases is crucial. CIHSR has well-developed departments and super specialized departments.
Our hospital, it has a range of medical facilities which has been all designed so that patient who comes here get a variety of options of medical services, and also we have formulated services which will cater to their specific needs. So we have all the regular departments like the medicine, surgery, orthopedics, obs gynae, ENT, eye, dermatology, and super specialty we have two, gastroenterology and pediatric surgery.
We have an automated perimetry here, Octopus. So with that, we check the visual field of the patient to see if the patient has any defect in the nerve or anything like that. Besides that, the patients that we see in the OPD, if they need some surgical intervention, we do various surgeries like pterygium surgery, like DCT, DCR, and most important, we do a cataract surgery, which is with the help of a phaco machine, which we have recently acquired. The benefit is that the incision that we do is very small, so there is a faster post-operative recovery. This alcohol norate phaco machine is one of the few machines which is available in this region.
We have various services in the anesthesia department. First of all, we have something called a pre-anesthetic checkup, where we check the patient on an OPD basis before the patient actually comes for surgery. Why we do it is to make sure that the patient is fit for the anesthesia that we are planning for the patient. During the PSC visit, we assess the patient and also plan the anesthesia procedure along with the patient, and we discuss the various options of anesthesia available for the same surgery, and as far as possible, we take the patient's consent for the anesthesia after discussing the different options with them. We have various equipments which we have recently acquired for our department, and some of them are, I think, unique for Nagaland, because I think not many hospitals in Nagaland have it. One of them is our fiber optic intubating scope, which is very useful for us in terms of very difficult airway cases where we can't intubate the patient in the conventional way.
In the general dermatology, we have skin biopsy facilities for those who need further examination of the skin by doing biopsy. We also do excision for those who require excision for skin tags. We have electrocautery machine, radiofrequency machine for those who need treatment for the wart removal. And we have chemical peeling for those who have acne and pigmentary disorders. We have non-ablative radiofrequency for those who want their skin to be tightened without surgical method. We also give Botox and fillers for those who required further improvement in their skin features, on the facial features, for their wrinkles and for improvement of their contour of the face. Besides this, we also have Buva chambers. We have the full body chamber and a half body chamber for those patients who have white skin disease, which layman people know it as leukoderma, and if they can come, we are here to provide the services. Now, the CO2 fractional laser is what we use mainly for improving the skin, like in skin rejuvenation, and we also use it to improve some of the scars which are not very deep seated. We also use it to improve and lighten the skin. So many patients are there who need this treatment, and we've been giving this treatment for many of our patients for the past 2 years now.
One thing that is really good about working here is that we cater to people who are really in need, the needy people, and that gives us immense satisfaction. We have, catered to a lot of people with urological problems, and Nagaland has been plagued with a lot of kidney stones, and in the early part, we used to refer patients to Guwahati, where they have to pay huge amount to just get a simple thing done. But now we have the state-of-the-art equipments here. It has become almost a tertiary center from all over Nagaland that people come here to avail treatment for urology.
Communication is key to human existence. The ability to hear, speak, and write is a gift. When any one of these faculties is weakened, we find ourselves in a difficult position to relate with others. We take a look at how speech and hearing therapist Christina Walling is helping people with such challenges.
As an audiologist, I deal with people with hearing problems. So my patients range from newborn babies to people over 90 years of age. So when somebody comes with hearing problem, we do something called the audiometry. For this, we go to a soundproof room. We put headphones over the person's ears and we check the hearing, let's say the hearing power of the person, so that based on that result, we know what kind of a hearing aid the person would need. Communication disorders like children with intellectual disability, with different syndromes, with autism, ADHD, they would have communication problems, so I help them communicate more effectively. And also with children who have undergone something called a cochlear implant surgery because they're unable to hear well, so I also help through speech therapy.
Give me. Thank you. Yes.
When I give speech therapy to little children, usually these children are 2 to 3 year old children who do not enjoy sitting and learning like how adults do. So we try to make it more fun for them by using different toys, puzzles, or activities like that that make them enjoy during the session, have fun, but also that they learn something from there.
Is it here? Yes.
Special needs children require school of learning, which are designed to encourage their participation and learning. A unique approach that involves parents' participation as well. Precious Gems School is located in the campus.
I couldn't find out any children with any form of disabilities for the first few months. After that, I visited different schools, the local schools, both government as well as private schools, and found out the schools having a lot of children with developmental disabilities. So I conducted workshops for these teachers how to screen out these children with different types of developmental disabilities. The teachers, they didn't know anything about these different kinds of disabilities. After my workshop, the awareness increased among the teachers, and they started sending children to our center. That's how we started the work in our hospital. So after coming here, I realized there is a great need to do something. With that, I started this developmental pediatric department with an intention to make a proper diagnosis of different kinds of disabilities among these children. The areas which we focus more on is some of the developmental disabilities like intellectual disability, autism, attention deficit hyperactivity disorder, cerebral palsy, and similar kinds of even specific learning disability, or some of the disabilities we focus. And initially we collect the histories from the parents. Based on the history, we will make a provisional diagnosis, and to confirm that, we do related tests. After making a provisional diagnosis, we counsel the parents and make them understand, give them time to come to our center for help. But children who are from distant places, we try to counsel them and we give them home programs. Once the child is diagnosed to have any one of these developmental disabilities, then we will give them a day to come and join in our special school. Now this program is unique in Nagaland because there is no other center that includes parents also for the training program.
My son, he improved a lot within 2 weeks. And not only my son, but even the parents also learn a lot every day. And especially like parents also, we share during the lunchtime, with each individual children problem, and through that, we encourage one another.
This training is for a period of 3 months. So the idea is at least within 3 months, the parents will learn the basic things, how to take care of their children.
We have a very active community health department. They have adopted 2 blocks, the Dhansari Park area as well as now the Metsifema block, and they go every week, they go and visit these areas, they visit the homes, and the staff provide the health education, and they also identify people with diseases. Those who need hospital care are then referred to the hospital.
The community health teams are going to 2 villages today, the first being Kekeho and the second being Doyapur. We routinely do this every Monday, and we try to cover different areas of Dhansaripar block. Today what we're going to do in this clinic is basically see pregnant women, and we're going to ensure that they have their routine antenatal checkups, as well as we're going to see children who are under 5 years of age, and these children are going to be weighed, as well as we're going to see their immunization status and ensure that they have immunization.
Traveling in the Northeast can be an adventure. The community health team, while on their outreach programs, have to pass through forests and even drive through riverbeds to reach the villages with medical care. With their stock of medicines and record books, they finally arrive at their destination.
The name of this project is called Strengthening the Primary Healthcare Services in Dhansaripar block. The unique part of this program is that even though there are 5 members in our community health team, we work with the government. The whole point of this program is that we facilitate and increase and improve the government services that are already available in this block. We realized that their services were not up to the expectations, and so all our programs are based on this. One of the main focus is mother and child health. So in our clinic, in a sub-center, when we come every Monday, we make sure that all the mother and children are given due attention. So first, when a patient comes, either a mother or child, they've registered, and the A&M in the sub-center registers. She also checks various parameters like BP, or for a child the weight. We also mark weight for age to see if the child is actually malnourished or not. We use the Shakir's tape to see a mid-upper arm circumference to see whether the child's malnourished or not. We also give some amount of education even prior to seeing the specialist, a doctor or a nurse. The antenatal mothers are seen primarily by Sister Azole. She does most of the antenatal checkups. Apart from this, we also have general patients who come from the village, and most of these patients have common ailments, and these common ailments are seen by me, or they might have chronic diseases like diabetes, hypertension, rheumatoid arthritis, or even problems with the thyroid. So they all come once a month, and they get their medications once a month.
Back in the hospital wards, we met a patient from Mokokchung, a beautiful town about 200 kilometers away from Dimapur.
My wife too, unfortunately, pressure stroke hoise, aro yatia palo workina Christian Institute of Health Science and Research Center Dimapur nise. Poila bi yati amar mano tuita tinta bi palo gina jaise. Yati aha tu oile amar ke bishi satisfaction ase. Yati first thing to oile saman kan bi ekta bi naharai aro timely edu for safa pura mano nurses kan otai timely tage.
So welcome to the Department of Laboratory Sciences. We just inaugurated this department. This is the receiving area for all inpatient samples. This is where we entry all the reports. let me walk you through the department. This is the microbiology, the bacteriology room, where we do all bacteriological cultures, antibiotic susceptibility testing and identification. He is Zuben, and he's performing one of the identification technique and the antibiotic susceptibility testing for bacteria. This is Palliative 9050. This is an automated system for blood culture and sterile body fluids bacteriological culture. Once this be positive, then we use this automated system called VITAC Compact 2 for bacteriological identification and the antibiotic susceptibility. Once these reportings are done, we enter in our computer and into the software. So we will be moving to, again, microbiology but serology department. This is the serology room where we do all the serological studies for infectious diseases. We have recently installed a fully automated workstation, ELISA workstation for all infectious diseases like HIV, hepatitis B, C. Then we would also want to go for other parameters like vitamin D, total IgE, etc. So we will be doing, this is the 4th generation, and we assume that the sensitivity will be better and the detection for all infectious diseases will be better. We also have the point of care machine for CD4 count. This is used for checking the CD4 values for the HIV individuals. We are an RNTCP center, that is the Revised National Tuberculosis Control Program. We are doing the microscopy, we are a microscopic center. We also recently got a gene expert for doing the molecular testing for TB. And through this machine, we can also not only know the quantity of the TB bacilli, but also the resistance pattern for the TB.
Okay, this is the histology department. Right now we have 2 cell analyzer which do all the cell counting and differential count for us. So this is the Sysmex XS800i. This is from Transasia, and this is the 5 parts machines. And this is also from Sysmex. This is XT1800i. So this is a bigger version, but it has a auto loader. That's the only difference. This also is 5 parts. And here we do our staining. Staining we do for Romanowski stains, mainly for the Lisman stains. So whenever there is an abnormality in the blood picture, so we do the stainings and we look into the microscope to look at the blood pictures. So we not only count the cells, but we also look at the blood pictures and morphology to do the studies.
We focus on quality control. We run an internal quality control, that is to see the quality of our tests, the parameters, the different parameters that we run. We also participate in an external quality assessment scheme, that is like Christian Medical College, that will assess the quality of our reporting, where we do fairly well. And we also participate in another external quality assessment in microbiology through the Indian Association of Medical Microbiologists, Gangaram Hospital, New Delhi.
Patients from neighboring state travel long distances to Dimapur for healthcare. We met Mr. Mohibul Ali from Jorhat in Assam.
কিডনি দুইটাতে পাথৰ হৈছে এই কিডনি বহুত জায়গাত এইটো ট্ৰিটমেণ্ট কৰিছে সব মানুহ অপাৰেশ্যন কৰিব লাগে বুলি কৈছে সেইটো কাৰণে ইয়াত ডিমাপুৰ হৈছে ডিমাপুৰ অহাৰ কাৰণে মানে এইটো আপোনাৰ এইটো অপাৰেশ্যন নকৰাকে পাথৰ ভাঙি দিম বুলি কৈছে সেইটো মই পাথৰ ইয়াত ভাঙিবৰ কাৰণে ইয়াত লাগিছে
ESWL is an equipment where we use a very strong wave instead of radiation. Initially, we do an X-ray with a radiation to find out the exact location of a stone. And after it is located, we saw the size and the place. We introduce a very high shock wave to crush the stone. And with medication and a lot of intake of fluid, the patient can pass out the stone and they don't need to undergo a operation. But it have to be done in setups of different setup. The first setup and subsequently they have to come for maybe 4 settings or 2 settings as per the size of the stone and the hardness of the stone.
Many times patients will be diagnosed as hypertension or diabetes or TB and they will be given medicine. But they don't know about their disease condition as well as the needs of continuing treatment, management as well as their diet and how to manage their life. So, education room, we used to conduct health education based on the needs of the patient. So usually Friday is our diabetic clinic and we have more patients in diabetic clinic. We have more than 4,000 patients right now and we used to call them on Friday based on their sugar control, and we can look after 30 patients every diabetic clinic every Friday. And on other days we used to give education on TB patients. Once they start their medications, we give education on TB, as well as we also give education on renal replacement therapy, those who are in end-stage kidney diseases, as well as we used to give education related to those who are having hyperuric acid. We used to give diet education. Hypertension, we used to give DASH diet, that is dietary approach to stop hypertension. And then we also give education related to renal diet, those who are having end-stage renal disease. And moreover, we give CAPD education to those who develop kidney failure. They will come for renal replacement therapy education, and as well as once they decided to do peritoneal dialysis, we give continuous peritoneal dialysis education, and we give training to the family members for the caregivers.
We have a program known as the CLHTC, the Community Lay Leaders Health Training Course, which is a distance education program from CMC Vellore, and it aims to train, lay leaders. Because India is such a vast country and doctors are very high commercial value, so most of them are not going to go to the peripheries, and a lot of trained medical people don't go there. So instead of sending people there, we get people from the peripheries, train them so that they can go back and be effective as health workers in their area.
The aim of the CLHTC program is to equip the missionaries with basic skills and knowledge for primary health care, because there are lots of dedicated missionaries working in rural areas where they need to take care of many people because there is no doctors and nurses nearby where they live. So after taking this training, they are able to give first aid, and they can identify the diseases like diabetes, hypertension, and they are able to give health education related to that, as well as they can refer the cases before it becomes very serious. And recently we have visited some missionaries in Burma who took training from here and they were serving in Burma. So with the training they were able to give first aid, and they also conduct primary health care training to the communities, and they have trained already 18 local people out there in simple language. I will be sharing only 2 testimonies which they were able to perform and which encouraged us a lot. There was one lady who was more than 100 years old who got a big injury over her neck because of her fall, and then there was lots of bleeding and they were not able to take care of her because there was no nearby hospital, there was no doctors and nurses. And with her needle and thread from her pocket, she was able to give 5 stitches with shivering, and she could able to perform well. And now the stitch is dry without any complication and she is alive. And in that case, they will not be able to take her to anywhere because by bike only they have to transfer the patient. And another testimony was like our missionaries, she was supposed to do a survey for a camp, and when she visited, she found a girl who was 12 years old with rotten bone over her leg, and she could identify her and could inform her organization, and they organized to arrange one chopper to bring her to Tunsan, so they could do surgery from Tunsan, and she could recover now, and she's able to perform herself, to take care of herself right now in Tunsan.
We also have a palliative care team, which is one of the strong points of the institution. There may be people suffering from terminal cancer for whom very little can be done by way of cure. But they need relief from pain, the family needs some help, also patients with stroke who are bedridden. So there is a team of a doctor, a nurse, trained doctor and nurse, as well as the counselor and the chaplain. They visit these patients right in their homes and help them and give them whatever medications to give palliation.
We are going to see a patient in Dimapur at home who is having a cancer. So they got admitted in there, but he's having pain, so just when I talk, he has pain or neck, no pain like that. Now auntie's problem is that it have become advanced stage, and then she is not able to go about her activity. That means like helping herself, going to toilet or just moving around the house. She is not able to do it herself. आपने इतिया बेसी बिखा है तो तेने खा पीछे ते टाइम भी लॉप साइक ना तो किमान तब कमी से तो कमती हो जाए तो भी रखी बो ना ये तो माइंड दे रखी ले आपने तो के पेन डायरी को है ना आपने ला नोट पेन इतना लिखी भी whatever we give, whether it's given relieving or not, and then we also ask detail next time when we come and evaluate what they have written. Aim is to achieve optimal comfort as well as the pain control.
Ami bimar hado treatment be first prefer para he treatment kurise first para last to mam phal para sai gina aise aro ite do jarkin khande bira pe hila hili kori ne bikha na para bara takhan ke mati sile takhan ahi gina horde be mam phal para sai dia karne itu be shi khushi pai ase
aro sister kan takhan be time di huti take patient to kinaka ase to kinaka ase inaka hospital pura ekta kupura ha to hutia to ama be mon to ekta bishi sandi hoi to
home visit is also a part of the whole palliative care component. So basically most of them terminal ill patient. Once as the disease progresses, the condition comes, if they come there, they will not be able to come to the hospital also. And taking them to the hospital, it involves a lot of people also, then vehicle transportation or like that. So when we first meet in the hospital, we do detailed workout, and after that we also tell that whenever any problem which we can solve at home, we will try to come and visit you and deal the problem, common problem at home.
The allied health science courses were started with the idea of catering to the other paramedical subjects. So we have courses for radio diagnosis technician, for the medical records technician, for the diploma in medical laboratory technology, the diploma in anesthesia technology and the diploma in ophthalmology and optometric technology.
College of Nursing CIHSR was started in the year 2011. Initially, it was having only 2 nursing programs, General Nursing and Midwifery, which was for 3.5 years, and Post-Basic BSc Nursing for 2 years. In 2014, another program was started, that is Basic Nursing BSc for 4 years. All the courses are affiliated with Indian Nursing Council, Assam Nurses, Midwives and Health Visitor Council and Nagaland University. The nursing students are taught basic nursing and also advanced nursing subjects, and they have classroom teaching, and also they go to the clinical area, provide care to the patients, and also they learn from the patients. College of Nursing has got 5 major departments, namely Medical Surgical Nursing, Psychiatric Nursing, Pediatric Nursing, Community Health Nursing, and also Obstetric and Gynecological Nursing. And the students, before they go to the clinical area, they practice the procedures in the lab and then go to the clinical area. The faculty who are in each branch will help the student to practice in the laboratories.
Every morning we come for a short time of devotion, and then we make a rota every month. So it's not just me who is speaking all the time, but we make a rota, and then every one of us we get the opportunity to share, and then the students, the staff, and everyone is welcome to just come and attend this morning chapel. That is usually for just 20 or 25 minutes at the most. So that is how we start our day every day from Monday to Saturday. And apart from that, we also have the prayer meetings on Thursday. So it's not just for the chapel committee members or just for the chaplaincy or chaplain, but it's for everyone. Everyone is just welcome. Whoever is free, they can come. Not just the staff and students, but also the family members of the patients who are here in the hospital. They are also most welcome to come and attend these prayer meetings on Thursdays. During the Passion Week also, we had our friend from Delhi, George Dawson, and then he came and he took a series of Bible studies for us. So it was a very pleasant time for each one of us.
There's a point of time when you say, Lord Jesus, I come.
Our motto is serve, nurture and transform. So we are predominantly serving people, the patients who come around us in our region. We want to nurture the people who come to this place as our staff, and in the process of trying to transform the people and the region around us, we ourselves should get transformed. So that's our motto.
With the sun setting over the Dimapur skyline, the work of Christian Institute of Health Sciences and Research, CIHSR, has only begun. Tomorrow will be a new day with its unforeseen challenges and golden opportunities to serve people, nurture friendships, and transform communities here in Nagaland and beyond. Come,